My name is Dr. Tristanne Spottswood. This is my second time here for Core 1 Plus. Return to Core 1 Plus for experience, for hands-on, and to learn around and with other professionals that also have experience in placing implants, restoring implants, and treatment planning. There's one particular case included a patient with an atrophic ridge, and they're very difficult to place implants because you don't have bone to use as a platform. So the complexity of this was anatomy and also soft tissue management, and also treating the patient and understanding the CT and the PA to know dimensions, depth, and width, and the placement of the implants. So halfway into my weekend with Core 1 Plus, I've placed 19 implants in a day at Core 1 Plus, and some others are actually placing up to 30. The effect, the importance of being 1, 2, 3, 4 times at Core 1 is experience. Cumulative effect, the cumulative knowledge, experience is key in treatment planning, key in placing implants, key in properly doing your judgment for treatment with implants, how to open a bite, how to restore properly, whether you're doing the immediate FP. What I've gained from my first time here to now is a level of confidence so I can hold the instrument, know where the drill, know where I'm going, and placing that with confidence. It's confidence and speed and the knowing, the predictability, knowing that if I start with one, what my end result, I know how to get to my end result. So this course has allowed me to gain the confidence in knowing my instruments and knowing how to use them safely and successfully. Taking Core 1 Plus is essential to finish the completion of your Core 1 experience. This gives you a conclusion, but also sets you up for the next course. So you have that knowledge, not only the instructors, the implants, your armamentarium, your setup, and how to treatment plan. So yes, Core 1 Plus is essential to finish your Core 1 series.